Deciding between a Medicare Advantage plan and a Medicare Supplement plan is just like deciding between a classic cosmopolitan and one with a twist. Ultimately, it depends on your taste. Today, we're going to be making your classic cosmopolitan. These are great for a fun night out with friends. And while we make this cocktail, or in fact, after we make this cocktail, while we sip on this cocktail and enjoy it, we're going to be talking about the pros and cons of Medicare Advantage plan versus Medicare supplements, really the differences between the two, and what we would recommend you keep in mind while selecting which plan works for you, both for 2025 and beyond. So let's go ahead and dive on in. So to make this cosmopolitan, these are generally a stronger cocktail. So we are going to start with 1.5 ounces of vodka here. All right, we've got the vodka. And then we want to add 0.75 or half of that amount of triple sec or Cointreau or just an orange liqueur. From there, we are going to add 1/2 ounce of lime juice. And we're going to add a little less than that of cranberry juice. Some people like it a little more cranberry juice, a little less. Sort of depends on your flavor profile. From there, we are going to go ahead and we have this glass here chilling. So that's quite helpful. We're going to add that ice to the shaker. We're going to go ahead and shake this up. Really get it mixed in there. It's always tough. We're going to strain that out. Into our chilled glass. And we have some orange peels here. So we'll go ahead and add some orange peel to the rim and go ahead and add a twist of orange right to the cocktail. So let's go ahead and enjoy our cocktail while we talk about Medicare Advantage versus Medicare supplements. Cheers. All right, so cheers. As we dive in, just a couple of quick points about Medicare Advantage plan versus Medicare supplements. I'll explain a little bit more in a few minutes about the real difference between the two. But as a reminder, Medicare Advantage plans, these include your Medicare Part A and Part B, your hospital and your doctor side of things. They also do include generally extra benefits, some dental, vision, hearing, etc. These plans also typically include your Part D drug plan, so your prescription drugs are included with your health plan. And last but not least, these are network-based plans. So HMO, where you have to go see a network doctors, PPO, where you can go in and out of network, they are generally network-based. Let's talk about the difference now with Medicare supplements. Now, these are kind of your more traditional route, like your traditional cosmopolitan, whereas the Advantage plans are a little bit more if you're adding a twist to it. But to kind of dive on in, there are 10 different supplement types that you can select between. You can see they're lettered A through N. Obviously, if you're going alphabetical, A through N includes more than 10 letters. But as you can see here, some of them are gone and some of them, this is just the way it looks now. So with that, regardless of which insurance company you select, if you're enrolling in, as an example, a G plan, it's going to be the exact same G plan from one insurance company to another, whether you live in Ohio or Florida or Texas. Now, not all of these plans are available in each geographic location, but these are the 10 supplements available. Now, F and C, as an example, if you hadn't turned 65 before 2020, these plans will not be available to you. They're phasing those plans out. That said, let's say that you're interested in a G plan. The way that one insurance company to another covers this G plan is going to be the same. So you could see things like deductibles, co-insurance, etc. It's all covered the same on the G. But, you could see the A covers far less. So those will likely be a lot less expensive than that G plan. But sort of that's how the Medicare supplement plans work. All right, so now that we know the general differences between the Medicare Advantage plans and the Medicare supplements, I want to go over a couple of quick things about how these plans work and when you can enroll in them. So Medicare Advantage, as an example, the one thing that I think is helpful to note on Medicare Advantage, I mentioned the networks, I mentioned the additional benefits and the drugs that are included with it. But the way that these plans work, you can see cost, pay as you go. Generally, these plans are little to no monthly premium, but there's co-pays for everything you do throughout the year. You go to the doctor, you're in the hospital, there's a set copay you'll know at the beginning of the year before you enroll in the plan. So it's essentially pay as you go or pay when you use the services versus pay in case you use the services, which on the other hand is what the Medicare supplements are. Essentially you're paying a higher upfront medical premium, but then you're paying little to nothing for the services that you need throughout the year. On these plans, they do not include your Part D prescription drugs, so you do need to purchase a Part D drug plan to pair with these. Additionally, there's generally no networks or referrals needed for these plans. Some Medicare Advantage plans for specialists you might need referrals. So now kind of when can you enroll in these plans? That's a great question that we get frequently. When you first turn 65 or retire, if you're over 65, when you first enroll in Medicare, I should say, you can select either of these options. Moving forward after that, every year that you're on a Medicare Advantage plan, you could switch between Medicare Advantage plans during the annual enrollment period, which is October 15th through December 7th of every year. Additionally, we filmed another video about the open enrollment period, which is the first quarter of the year, January 1st through March 31st. And that is when you have one option during that first quarter to switch from one Medicare Advantage plan to another in the event that you don't like your current plan. Medicare supplements, on the other hand, if you apply within 6 months of your 65th birthday or when you're enrolling in Part B, you are eligible to sign up for a Medicare supplement with no medical underwriting questions. After a certain period of time on a Medicare Advantage plan, if you want to switch to a supplement at that point or between supplements, you would have to answer medical underwriting questions. So, a lot of people can still continue to answer those questions, but it's an important note for everyone to realize. So one important thing to note, and we get this question quite frequently, is what to do if you're enrolling in Medicare after you turn 65. So if you're continuing to work and staying on employer health insurance, when you turn 65, 66, and maybe you're retiring at 67, what happens then? Well, as long as you stay on your employer health insurance that's considered creditable coverage, you'll have the opportunity when you initially enroll in Medicare Part A and Part B to select which of these Medicare plans you would like. Essentially, you're going on Medicare just a little bit later than other people that would enroll right at 65. So we really encourage people that even if you are planning to work past 65, give us a call. We can help you kind of assess whether your employer plan or one of these Medicare options would be right for your specific needs. And, the question I always get at the end of the day is, which one's better? Which one should I enroll on, the Medicare Advantage or the Medicare Supplement? And frankly, there's not one right option for every person. We get a lot of couples in here who maybe they have different doctors or different prescriptions that they take and different medical needs, and ultimately they go on different options. So there's so many different Medicare options to select from. What I really encourage you to do is look at which option works for you specifically, whether it's the Medicare Advantage, paying less upfront and more when you go to the doctor, or the Medicare Supplement, paying more upfront and less when you go to the doctor. Ultimately, at the end of the day, you buy health insurance in case something happens, so you don't want to be worried all day about what could happen if you don't have the right health insurance. Thank you so much. Cheers to Cosmopolitans and cheers to Medicare Advantage and supplements.